Tonight on Special Edition, Pfizer Chairman and CEO Albert Bourla, the man at the top of one of the most influential companies of our time and one that's impacted millions of lives. Welcome to Special Edition. I'm Andrew Ross Sorkin. Over this series, I'm going to be talking to newsmakers, telling their stories in a way you haven't heard before. Up first, Pfizer Chairman and CEO Albert Bourla. Bourla took over the CEO role just a year before the pandemic hit and led the company as it raced to produce a vaccine, which it did in less than 9 months. Before 2020, Pfizer may have been best known for Xanax and Viagra, but now we all know about its vaccine and also its COVID treatment drug, Paxlovid. But all of it has not come without controversy. Questions about mandates, free speech, and science itself have all become flashpoints around the globe. So what's the next big medical breakthrough, and what lessons did we learn that may help us get there? Bourla is speaking out for the very first time since recovering from COVID for the second time in just under 2 months, which itself has created headlines. Albert Bourla, welcome to Special Edition.
Thank you very much for having me here.
So I want to ask you how you're feeling, in part because you just had COVID the second time in literally 2 months. And I think that's raised a lot of questions for a lot of people about vaccines, mandates, free speech, all of it. And I'm hoping that that's what we can talk about over the next half hour.
Thank you. Indeed, I had COVID for the second time. I didn't mean to create all this debate about vaccines and social distancing. I was surprised that I got it twice. Probably I didn't have the opportunity to sequence the virus because I was not in the country. When I got it, I was actually in the UK. And I spent 5 days in the hotel. It was very light in symptoms, and I took Paxlovid again, and so I became negative in 2.5 days. I just had to stay in the room for 5 because that was the rule.
And how are you feeling now?
I feel very good, very good.
And were you surprised? I mean,
I was
within
surprised.
2 months.
Probably, if I have to take a guess, it was the new strain, and when I got it back in August, it was the old strain of Omicron. I think I didn't get vaccine myself.
Hold on. When you say you didn't get the vaccine...
I didn't get the booster, the bivalent booster, the new one, which is tailored to Omicron, because I had COVID in August. So I have to wait 3 months before I get it. So in the meantime, as I was waiting 3 months, the strain didn't wait and came to me.
And you had taken Paxlovid in August.
I took Paxlovid in August as well.
And you took it this time as well?
Yes.
And was there any part of you that said to yourself, something's going on here? Should have I not taken Paxlovid the first time? Did the Paxlovid itself make me, have less antibodies against it the second time?
No, all of that I know the answers to that. None of that is true. I took Paxlovid the first time, and because this is what my doctor recommended, and I was able to have very light symptoms and to stay home. The second time, the symptoms were lighter, but I was able to become negative pretty soon. No, I think...
But do you look at this as a rebound case?
No. After 2 months. Rebound cases, when they are discussing it, is within 1 or 2 weeks, not within 2 months.
There are some people who believe that Paxlovid, which is only a 5-day course, should be extended to 10 days. That for those who get a rebound case, and I know you didn't get a rebound case, but for those who do, and it appears that the president might have gotten a rebound case and that Dr. Fauci might have gotten a rebound case, that the way to prevent that would be to extend the course. What do you think of that?
I think it is up to doctors to prescribe it. Right now, we do not have any evidence generated by clinical data that in rebound you need to give a second course or you need to extend the treatment to 5. We are running right now clinical trials in immunocompromised that they are going to 15 days. But this is a special group of people and we haven't yet the results. So it's up to the doctor. I know that Dr. Fauci announced that he took during his rebound second course after his doctor advised him. He said publicly. But so it's an individual case. But you need to know that the rebound case, it's now very well documented that it is a COVID phenomenon. So people that don't get treatments, they are having rebounds equally often as people that they are getting treatment. So again, it is another wrong information that is circulating and discourage people for no reason.
President Biden, in an interview on 60 Minutes, said that the pandemic is over. When you went on Twitter to announce that you had gotten COVID for a second time in under 2 months, you said the virus and the pandemic is still with us. Yeah. Which is it?
Oh, no, it is with us. And I think President Biden also said the same. He said there's a lot of work that we need to do with COVID. He also said the pandemic is over, but he explained that he meant, look, nobody's wearing masks. And from that aspect, in the way that people are living back their lives, they do it like if the virus is not there. Unfortunately, the virus is here and will continue coming.
What do you think, though, of the idea that people look at your own personal experience and they say, do these vaccines work? Should have we gone down this path of the mandates? And all of these other questions around it.
I think few people are asking these questions, but they do. There's the minority, and there are people that they never believed in the vaccines. And I don't think now is the time that they will change their minds. Without vaccinations, likely I would have very heavy symptoms. As we all remember, the first year of COVID, when people were dying and people were, we all knew someone that lost someone. The things changed not because the virus became better. The things changed because people started getting vaccinated. So all of that reduced the severity of the symptoms. It's very clear that the vaccines have saved lives.
How much do you, though, think it was the messaging, that the messaging was wrong? Because when the messaging first began, you were to take the vaccine both to save yourself, but to save the rest of society as well. That early on, it was going to break the lines of transmission. And I think one of the things that's happened since then is that transmission line has not been broken. And people look at your own experience and say, look, if you can still get it, a month or two later, what is this good for?
It is good because you're not going to die. The vaccines have been extremely, extremely effective still against heavy disease, against hospitalizations, and against deaths. All the statistics from all the countries are undisputable about that. The truth is that in the beginning, they were also against infections, so you would not get
infections, transmission.
Infections and transmissions, but that as the virus started mutating, and then as people were not current with the recommendations because the vaccine was waning after 6 months, then, of course, you may get the disease, but still, you get the disease and you don't die. Right. And
look,
the situation would be right now very different if vaccines were not around.
You know me. I've gotten the vaccine. I'm one of the big maskers. We've had these conversations over the past 2 years. But I raise these issues because I think right now there's the distinction between what the initial messaging was, and those who are skeptical looked at that messaging and then said, look, but actually later on, so it was a different story.
I hear you. I hear you.
To the extent that that is a challenge for you, and that's a challenge for the world and for the scientific community, what do you do about that?
I believe through COVID, a lot of good things happened. And one of them was that science demonstrated its power. And also the life sciences sector demonstrated the value to society. But also bad things happened. And that was that health issues started becoming and be debated with political terms rather than scientific terms.
But that politics is still going on today.
Let's just be honest. If the other side gets in Florida, they are going to impose mandates on vax. They are going to make you get boosters and do all that. And as long as I'm here, that's your choice. That's not the government's choice.
There was a politician from the Netherlands in Brussels. There was actually some testimony with a Pfizer executive. And he asked her whether the vaccine had ever been tested to prevent transmission. And she effectively said on the tape, she didn't use the word transmission, but she used the word immunization. And she said no. And then he came out quite publicly and said, look, this whole thing, vaccines never tested on preventing transmission. This means the COVID passport was based on a big lie.
Governments pushed millions of people worldwide to get vaccinated by telling them, telling you to do it for your grandmother. Literally imprisoned people within their own homes. All of this was based on the idea that vaccination helps prevent the spread of the virus. Otherwise, why should people out of society? But this has now proven to be a big lie.
What do you tell the public about that?
I don't know what he's referring to, but the vaccines were tested extensively in clinical trials, and they were tested extensively in real world. And there are data from independent authorities, not from companies, that they spoke about infections, they spoke about severe disease, they spoke about hospitalizations, they spoke about deaths. And the vaccines have an effectiveness in all of them. Now, the effectiveness in infections over time wanes, so the 96% that we had recorded in the clinical trials and was confirmed in all real-world data, they lasted 6 months and then started going down.
But in terms of transmission then, or infection then, that was based on the first variation of COVID.
And then, of course, we had different variants. But the vaccines continue to be very effective in real-world data and in the lab through the new variants, with the exception of Omicron. The first variant that was able to significantly escape the protection of the original vaccine was Omicron.
When you see a Djokovic, for example, say, I'm not taking the vaccine, and to the extent that he'll give up playing in the U.S. Open because of that. And one of the things that a lot of these players and all sorts of people who have been skeptical have said is it's not changing the transmission line, the infection line. What do you tell those people?
I think Djokovic is wrong, and I think Federer is right, because we are using one example of someone who is a celebrity that is taking one position, but there are hundreds that are taking very different positions. The vaccines is not about us discussing, it's about data, and have been proven by independent studies by all countries in the world. There is literally no country that they have their own data that have saved lives.
What is your thought about the debate about all of this? So we talk about science and data, and then there's a free speech debate, which is to say there are other folks who have taken to social media, have taken to traditional media, that have been skeptical out loud. And then there have been places that have said, we're not going to broadcast that, or we're not going to publish that skepticism or that reticence about these vaccines.
I think I will separate two things. One, it is people that they have their own concerns, and they don't believe for any reason or trust, and they want to express themselves. And I think they should be free to express themselves. And there is organized disinformation that is typically run by thousands of robots, that is spreading information. And those people, I think they have a significant interest in doing that.
So, but where's the distinction and where is the line? And I ask because you might have a Joe Rogan, who runs a podcast. There were people, artists on Spotify, where he is employed, that have said that they were going to leave the platform because of what they thought was misinformation that he was providing. Should that information be allowed to be broadcast or not?
I think it should be allowed to broadcast as long as it's someone behind it and it is a person. I believe that this is the situation, and I can say it. I think I believe in freedom of speech, and I think we have more to lose if we suppress that, than to win. But as I said, also, there are a lot of organized efforts that they are not individuals, but there are just machines that they're spreading news. And those things are costing lives.
Right. But you take issue then with a Twitter or a Facebook or another social media site that takes down this information? Because for a long period of time, maybe less so today, that's what was happening.
I think their processes, in most of them, they are quite robust. And they differentiate between this disinformation that is coming and the individuals that express skepticism.
Do you think, though, that and look, there's an argument to be made that suppressing some of this debate has actually led to more skepticism on one end, and on the other end, that the debate, if there is one, or what you might describe as misinformation, has led from a behavioral science perspective to a much grander challenge for the globe?
Yes. I think that the division already has occurred. I think those that in the world that they don't believe in vaccines, they will not be convinced against. And those that they believed in the vaccines, I think the ones that will continue doing it. I think it's an old debate. If we believe not in the vaccines, it's going to be tough. Already we see the wave coming up in Europe.
Has your view about all of us getting COVID or not shifted? And the reason I ask is, about a year ago, last fall, we spoke, and I asked you whether it was invariable that I was going to get COVID. I ultimately did, by the way. And you said, no, it's not predestined or preordained that you will. But then folks like Anthony Fauci have said that we're all just going to have to live with this, and virtually everybody will, at some point, get COVID. What do you think?
I think I got it twice, so I believe Dr. Fauci that many people, not everyone, but the vast majority likely, because look what
likely
is
to
happening.
Get COVID. The vast majority of the world is likely to get COVID.
Look what is happening. The virus will remain among us, and social distancing is disappearing. And less people are making the vaccine than in the first year. So what does it mean? No social distancing, new variants, people with waned immune responses, many people, because they don't get the vaccine, will have many, many, many new waves. And will be more severe, unfortunately, because if your immune system is not primed with a booster, and it's been already a year or a year and a half since you made your first vaccine, you will get more severe symptoms.
How concerned are you about this particular winter?
I think it's going to be tough, and it's going to be tough. Already we see the wave coming up in Europe. Usually there are 4 or 5 weeks after Europe that we see a wave in the US, and then follows the rest of the world. Thank God we do have vaccine that it is very effective against this variant, but not many people have done it so far. So if we won't pick up between now and the next 5 weeks in vaccinations rates in the US, so that people will be immune, I think will be a tough winter.
And do we think that we will ever come up with a vaccine that eliminates it entirely?
COVID. It's a very nasty virus, and even if you are diseased, which is rare, usually you have immunity, right? I was a good example. I got within 2 months the COVID. It's changing constantly. But what I feel it is that because of the RNA technology, we are in a position to be able immediately to follow. So I will give you an example. We are constantly monitoring the variants. And we see a small variant that it is 1 or 2% of the cases in the world. We will test if the vaccine works against this variant. If for any reason we see that it doesn't, we start already producing a new template to make a vaccine. And we monitor. If it grows to become dominant, we are already ready. Because at risk, we started producing a vaccine, which means that we will be able to follow. So we will have vaccines that will be very effective against new strains. I think the challenge is to convince people to do that.
How focused are you on the midterms coming up, and how focused are you on 2024 when it comes to the politics of this country, whether it turns out to be President Biden against former President Trump? Do you think about that?
Look, I mean, our job is not to get involved in politics. Our job is to get involved and advocate for policies. And policies that they are advancing healthcare is a good thing to be able to.
But you were intimately involved with the White House during Warp Speed to
but
get
I was intimately involved not about their elections, or I was intimately involved about what do we need to do to expedite the development and then the manufacturing.
But are you concerned more about one party over another?
No, I don't think so. It's about parties, and it's not our job to choose parties. Our job it is to work with both on policies that we believe are enhancing innovation, science, and patient centricity.
Now that we have mRNA technology, what do you think realistically, 5 years from now, if we're sitting together, what kinds of diseases, what kinds of medical breakthroughs do you think we're going to see?
I think we are just scratching the surface.
I wanted to ask you about the Inflation Reduction Act, because as part of that, there's a provision that enables Medicare to negotiate the price of high-cost drugs. Pfizer came out and said that that bill could threaten the future of groundbreaking cures. What do you mean?
This is not about negotiating, right? It is about price setting. So the process is that the government will tell you this is your new price after 9 years, for example, and you either accept it or there is a 95% penalty that they impose on you. Because there is a price setting. That will create a lot of issues. I will give you an example. Oncology, usually you are launching a product with a very small indication because you go first in very fragile population, people that really they don't have any other option. And then over time, 3, 4, 5 years, you're bringing the medicine to new cancer patients. Because you knew that you will have patent protection for many years. Now, basically, you're losing this protection or you're losing the price in 9 years. So it wouldn't make any sense financially to have research on that field because you won't have time. I don't think, frankly, even in the Congress, they knew what they were doing when they voted for that. I think I'm hopeful that a technical fix can come one day to fix this type of issues. But that's a very tangible example. But I can see a lot of the cancer companies that they were investing on these medicines not to do it anymore.
What do you think is a fair way to price drugs? This is a philosophical question.
The way to price drugs. It is not how much it cost me. Bad luck if it cost you a lot of money. It is not how much it cost me to manufacture. It is what value I bring to you, to the healthcare system. If I bring a medicine that is reducing heart attacks, that has a value because you are avoiding cost of bypass surgeries, of hospitalizations, of loss of productivity, of people stay home. That's how you need to price. And by the way, when we discuss a price, either in Europe or in the US with whoever, this is how we discuss it. We don't say this is the price we think. We have a whole study that demonstrates, based on data, what will be the cost effectiveness of the drug.
But you understand when an American says, look, they spent X to develop it, I get that, and the actual cost of each pill is $1 or $2, and I don't understand why, when I walk into CVS, it's costing hundreds of dollars, right?
No, I think it's absolutely true. First of all, it shouldn't cost him nothing but a very small copay, because they should have insurance. The second, it is not the cost to develop this drug. It is the cost of failure, because from 100 drugs that they start, only one will make it eventually, right? So the other 99, they will die in different stages of the development, some at a very late stage that cost a lot of money. So that's the idea that you want to take the risk and invest. But don't expect that you will price your product based on I spend that much money, I need to take. You should expect to price your product based on the value that you bring.
So tell us what the future looks like. I mean, now that we have this mRNA technology, what do you think realistically 5 years from now, if we're sitting together, what kinds of diseases, what kinds of medical breakthroughs do you think we're going to see?
I think we are just scratching the surface of the technology. The first wave, I think, will be more vaccines. Right now, we only have COVID vaccines. I think, hopefully, if science proves itself, we will see flu vaccines, we will see zoster vaccines, we will see multiple other vaccines with this technology that will get better results than the current vaccinations. The second wave, I think, likely will come in oncology. Oncology, in cancer. There is a lot of efforts happening right now in hundreds of companies, actually, with mRNA against cancer. It hasn't produced any product yet, but there is so much happening that I'm optimistic that one of them, at least, will yield results. Then we go to the third wave, which is about genetic diseases, diseases that they are due to a mistake that exists in our DNA. We have a gene that is missing, and we are having hemophilia. We have a gene that is missing, and we have some other neurological disorders. And those people are condemned because, more or less, in most of the cases, or they're having very difficult, let's say, maintenance. Now we can speak about cure. We can correct their DNA, that mistake. So there is a lot in the works right now.
Albert Bourla, thank you for the conversation.
Thank you very much.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.